right, I think we're good to go. All right, hi everybody. Welcome back to the Greater Sydney Landcare weekly webinar series. This is webinar number 5, and it's a special one. First, I'd like to begin by acknowledging the traditional custodians of Greater Sydney region. I'm on Darug country myself, and acknowledge the elders past and present. I acknowledge and respect the continuing culture and contribution they make to the Greater Sydney region as the original land carers. I extend that respect to any Aboriginal or Torres Strait Islander people joining us tonight. So today is actually Are You OK Day. So it's our national day of checking in, making sure people are okay with life's ups and downs. And connecting to that, we're joined tonight by Associate Professor Xiaoqi Fang from the University of New South Wales and Professor Thomas Astelbert from the University of Wollongong. And they've done some really great research into how green spaces, particularly tree canopy cover, contributes to our mental health and well-being, positive mental health and well-being. And it may want to make you plant some trees. If you do so, you're always welcome to get in contact with us, as we're always out planting trees as part of our Creating Canopies project. I'll tell you a bit about that after we hear from our guests. In terms of housekeeping, there's a question and answer tab at the bottom of the screen. You can click on that. If you have any questions, type them in and we'll get back to them when the presentation is finished. And I'll hand over now to our guests. Thank you very much.
I just realized I muted. So thank you very much for your introduction and inviting us today. And today's right, Are You OK Day? And I actually got several emails from my colleagues, and I feel really warm and nice. And I think it's probably a really nice day to talk about, especially the spring is coming, and today particularly warm in Sydney. That I hope that eventually we could have an outdoor day. So I'm Xiaoqi Fang from University of New South Wales. You can call me Xiao. And today we are going to talk to you about our research. And I'm also a funding co-director of Power Lab, which you can see our website on the right top corner. Power Lab stands for the Population Wellbeing and Environment Research Lab. We have done quite a lot of research on environment, particularly about green space and health. And the founding co-director, Professor Thomas Astelbert, we're going to co-present with me today. Okay. So quite a lot of the research we're going to present today is based on one of the large projects co-funded by Health Innovation and also University of Wollongong. We also have research funding from Australian National Medical Research Council and Heart Foundation. So this is actually a really memory pictured photo we took just before the pandemic. It was just around Christmas 2019, after a few months, and we're still in lockdown. And I can see some of the faces of our PhD students, and they now have already graduated and also very happy that they found a really good job during this difficult time. So I'm now going to talk a bit more about our research. And so this is a photo we took a few years ago, go back 2016, I think. Thomas and I was the two only Australian researchers has been invited to discuss with other research from all over the world. They're from US, from Europe. We're talking about what are the pathways linking green space to health. And eventually published this paper together, and this is one of the most well-cited paper in our field at the moment. We all know green space are really good for our health, but which pathways? And we think they probably have 3 major pathways linking the green space and health together: restoration and building capacity and reducing harms. So when we talk about restoration, we're talking about when we go into park and we feel very relaxed, which is good for our mental health. And I think probably, if not all of us, most of us, particularly during the lockdown, the pandemic, we all have the experience pressured about our local park, going there, just relax. And it's not just about get the fresh air and hear and listening the bird songs, but also just say people around us feel that we are still connected, not isolated. And this is really good for our mental health. And also going to the park, some of us were doing some exercise and which help us building our physical health and which is building the capacity. And overall, that is good for our health. We also think the third pathway is reducing harm. Be living closer to green space or there's a lot of tree canopies, it potentially could reduce some of the harm, such as heat wave, reducing the heat, and also reducing air pollution and even noise. And all that is good for our health. If you're interested about this paper, you can download it via our website or just Google this paper. It should be free download for you to read. So now I'm going to show some of the research we have done in the last few years, which we probably published about 40, 50 papers just around green space and health, but today we're just only going to show a few of them to demonstrate about how green space benefits us over our life course. First is that when baby still in mom's belly, so this is a systematic review and meta-analysis conducted by our PhD student. You may ask what is a systematic review or meta-analysis. Essentially is that we have looked at about all the publications and from various countries in the last 10 years who have done research about explore the associations between green and blue space and the birth outcomes. And then we find that the overall general trend is that there is strong associations between the green space and the birth outcome. People living closer with more green space, they tend to, their babies have a healthy birth weight. And you may think, well, so what? Why that matters? We all know that baby born with lower birth weight, that later on they will have higher risk of developing diabetes and heart disease. So it's really important that our children have a healthy start. And our research and others' research shows that this is the case. And if the moms living closer to green space during the pregnancy. And then we look at about children. So what we have done is that we're using Australian longitudinal study of children. We look about children's mental health and well-being. Not only look at about if the children are living closer to green space and the amount of green space that they exposure to, but also the quality of the green space. And no surprise, we find that when children living with a good amount of green space, we talk about 20 to 40% of green space is really good for their mental health well-being development. But we also find that the quality of green space really matters. Children live with high quality green space, they have better mental health. And the one thing I want to point out is that this study is a longitudinal study. So what does that mean is that the study follows the same children over time. So you know how their mental health well-being developed over time. And as you say on this graph, and this you can see that when children grow up, the mental health well-being gap is actually widened between the children who always live with better high quality green space and the children who are living with low quality green space. So the one always live with high quality green space, their mental health well-being is better. And also this gap is widened over time when they grow. And we also find that green space quality matters for our children's pro-social behavior. So what is pro-social behavior? That children being kind and helping each other. And we find indeed that children living with high quality green space nearby, they tend to have pro-social behavior. That is no surprise either, because when children go into green space or park nearby, and the parents probably will only allow them go if they feel the green space is high quality, is safe. But when children go into the green space and the park, they don't go just by themselves. They go with their family, their friends. There's a lot of interaction, and most of them probably very positive. And I think given the situation we are all in now, the pandemic, the COVID lockdown, is more than ever, we should provide not only just outdoor space and a lot of green space, but also high quality green space for our children. And this is where they could meet and grade and develop their social relationship and also pro-social behavior. We also had a look about the green space. How does this relate to adult? We find that young moms, if they're living with high quality green space after give birth, they could have a 26% of lower odds of psychological distress than their peers who haven't living with a high quality green space. And I think this is a really strong message that we really need to provide high quality green space to everyone, because there's a huge health benefit. But you may already ask this question in your mind. What does high quality green space mean? I have this question too, because it might mean high quality to you, but it could mean low quality to another person. For example, to the dog lovers, if in a park there's a space for off-leash for their dogs, they think this is high quality. But for exactly the same reason, for some others, they don't quite like the dog, or they worry about, there will be some poo around on the ground. They may think this park is low quality. So with that in our mind, that we actually had a winning grant application last year, which is one of the only 5 funded in Australia and UK, funded by National Health Medical Research Council and also UK Research Institute, which we would like to investigate about park quality. What kind of park quality we're looking for, and how does this benefit, particularly on our mental and heart health? This is a better parks and healthier for all project. And we're going to work with a lot of Australia researchers from multidisciplinary research background, and also our colleagues in UK. And if you want to learn more about it, please get into contact with us, and we will also update about the project progress with our website. Now I would like to hand over to Thomas.
Thanks, Xiao. So what I'm going to do now is move ahead with some more of the research that we've been doing. And you'll hear me ask politely for Xiao to move the slides across every so often. Take no notice of that part. So what are we finding here then? Well, we've been trying to look a little bit beyond the conventional narrative that going out and getting a dose of green space or getting more woodland and trees in your life is a good thing. We sternly think that is the case, and we've got many studies showing that is the case. And I'll be showing you some of those. But we've also been trying to look beyond the traditional narrative to try and find out some of the perhaps underappreciated ways that urban greening, that restoring and conserving the tree canopy within our cities and the parks and woodlands and all the rest of it, can also be good for our health. And so this is one of those first cab off the rank type of analyses that we did and published only just a few months ago. So it's still very fresh, and we're very happy to share it with you. And effectively, we were interested in the proposal that green spaces, parks, woodlands, and other green areas can be great places to get outdoors and to be social, to be neighborly, to meet your neighbors in some cases. I can't be the only one on this call now who over the last 18 months has found myself going out and spending a lot more time in my local parks as a way to just try and cope with all the disruption that's been caused by the pandemic and all the rest of it. So we looked at the issue of loneliness because in Australia, 1 in 4 adults, I think, is experiencing a profound sense of loneliness on multiple days a week at any point in the year. And there's many studies now which show that the experience of loneliness is related to, is predictive of later life significant health issues such as diabetes and heart disease and even dementia. So prevention of loneliness really could matter a lot. And let me just clarify, when I mean loneliness, I don't mean being on one's own. I'm sure there are many people on the call who feel perfectly content and even connected, walking solo through the mountains or fishing in solitude down by the lake. That's not what we mean by loneliness here. What we mean by loneliness is the feeling of deprivation of quality relationships, with quality experiences with other people when that's needed and wanted. So therefore, a person can feel lonely walking down a crowded street or being in a crowded restaurant or lecture theatre. It's a feeling. It's not necessarily an objective thing you can see. And so what do we find when we look at this hypothesis, which is, does more green mean less lonely? Well, the answer is actually yes. In our study of Australian adults living in all of the major cities across the country, we looked at people over about 4 years who weren't lonely and saw who became lonely over time, and about 12% did. And we found that the levels of loneliness over time were appreciably lower among those in cities, among adults who had more parkland, more green spaces nearby that people can go into and mix socially with their neighbors, to maybe meet their neighbors for the first time in some cases, but also just to feel a sense of belonging in the communities that they are living. This seems to matter so much here right now in this age that we are in. That's for all adults in general. And to give you a quick nerdy stat, if we were, the evidence seems to indicate that if we were able to raise up levels of parkland nearby from less than 10% to 30% or more, that would lead to potentially a reduced odds of becoming lonely by about 1/4. In other words, raising up parkland to about 30% could reduce the odds of becoming lonely by about 25%. That's in all adults. Now, a really critical thing here is that we're not all at the same level of risk of becoming lonely. And you probably will have guessed it already, that those of us who live alone, and I think that's about 1 in 4 of us at the last Australian census, have a much higher risk over time. And what our results also show is that among those of us who are living on our own, our risks of becoming lonely over time are even lower if we have more green space nearby. So green space is good for potentially preventing loneliness in the average adult, but especially among those adults who are living in single-person households. The odds of becoming lonely among those of us who have 30% green space nearby are reduced by about 1/2. That's quite a lot. And within the grand scheme of things, in terms of the other available interventions for loneliness, there isn't actually a lot out there. And what it suggests is that our investments in urban greening may have even wider benefits than perhaps are commonly appreciated. Next slide, please, Sharon. Thank you. So let's get back onto the rails of the conventional narrative, but take a slightly different focus, because some of you may be asking, Well, you know, the issue about quality green space is well made by Xiao earlier, but what about different types of vegetation, different types of green space? Can we have any evidence on that to inform potential urban greening strategies? And the answer is yes. So what Xiao and I did is we were able to access data on about 250,000 people living in Sydney and Wollongong and Newcastle and other urban areas in New South Wales. And we're able to link data on the amount of tree canopy, the amount of open grass, the amount of shrubbery within about a 1.6 kilometer radius of home. That's about a 1 mile buffer or catchment area. And we're able to look at this in terms of people's mental health, both at that particular point in time, but also how their mental health changed through time. And that's really important because in epidemiology, we're always concerned about the issue of reverse causation. And to get a little nerdy for a second, what that means is we're always a little bit concerned about whether the environment is having the impact on our health, or whether our health is leading to us to select into certain types of environment. And that might be related to our income and education and employment, the relationship status that we have at a particular moment in our lives, and other things like our age. After taking into account lots of competing explanations and this reverse causality issue, we were able to find that those of us who have more tree canopy nearby, specifically within cities, have appreciably lower odds of developing psychological distress. Now, that's not just at baseline, but over time as well. And that's really important because it lends greater credibility to these analyses. It provides more weight to them, more heft. As a general rule of thumb, what we were able to find is that if we're able to achieve levels of tree canopy cover at about 30% within a short walk from home, that was associated with around about a 30 to 31% reduced odds of developing psychological distress. So it's about a 30-30 type of way of remembering it. Could be useful. Next slide, please, Xiao. Now, here's one which has really caught the ear of many people who we work with in hospitals, our clinician colleagues, because the prevention of type 2 diabetes is really, really important. The healthcare costs of diabetes in Australia are very high, and the burden on people's lives, the impact on quality of life is substantial. And the more we can prevent diabetes, the better. What we did was we took the same data and said, well, if more tree canopy helps us to keep more healthy in psychological terms, what about in physical terms? Does it help us to reduce our odds of developing type 2 diabetes? And the answer is yes again. Similarly, if we were to increase the levels of tree canopy within a short walk from home up to about 30%, the odds of developing diabetes reduce markedly. And not only diabetes, but also hypertension and also heart disease too, because they're all linked. This is what we refer to as cardiometabolic health. It's all great news. Next slide, please, Xiao. Thank you. So it is good news, but as is often the case with scientific research, there is a tendency for it to go left unnoticed on, well, dusty library shelves in decades gone by, and I suppose dusty internet search engines nowadays, I guess. But in our case, we've worked really hard, Xiao and I, and those who work with us too, to try and spread the message, to try and put the research which is being done in this neck of the woods, in this patch of the world, on the footsteps, on the desks of people who can really drive change in local communities. And so with our clinical colleagues up in places like Western Sydney, where there are very substantial challenges with type 2 diabetes, they are heeding what we've been finding in our results and championing investments in urban greening in places like Blacktown and Mount Druitt and other suburbs across Western Sydney, where there are low levels of tree canopy cover and where potentially the restoration of urban greening could have a real game-changing impact on population health. It's not a panacea, but every little helps, right? Not only the health sector, but also urban planners too. Down in Wollongong, the urban greening strategy over the next 20 years or so has cited our work specifically, and our work has been informing their strategy and what they're doing down in the Illawarra. And also just earlier this year, a tremendous result for the City of Sydney with their Greening Sydney strategy. I'm so delighted with this because it's a clear evidence-based strategy where they've actually said, we're going to try and increase canopy cover to about 27% and green cover overall to 40%, including investment in 700 new trees every year for the next 10 years. And that's a marvelous result. And once again, it's evidence-based, which is absolutely fabulous. Great things are happening, changes afoot. Next slide, please, Shao. And more generally speaking, it's wonderful to see that the Premier's priorities on urban greening for investing in high quality green spaces and trying to improve equity of access to high quality green and open space is happening in urban areas across the state of New South Wales. This here is one of my favorite photos of a park in central Sydney, in an area which is quite high density called Zetland. And from my point of view, I think it shows that a high density community can be built with nature in mind. And this park here is a real hub for the community where it's regularly used throughout the day and even into the early evening. People are running around it, taking their dogs out, meeting each other for a natter after work or at their lunch break or whatever it may be. It's a real place where it's stimulating belonging and a sense of community. And I think this is a really, really great example. Next slide, please, Shao. And the other Premier's priority, of course, is investing in tree canopy cover. And there's an equity dimension too to this, of course, because in the North Shore, it's quite leafy. And on a hot summer's day, in many areas, you're able to walk down the street and you've got a decent amount of shade to keep the direct sunlight off your heads. And you can keep cool as you're going about whatever it is that you're walking to. But that's not always available. That level of amenity isn't always available in all parts of Sydney or other urban areas. In Blacktown, over in the west, where once again, big diabetes challenges, there's low levels of tree canopy cover, and it makes it quite challenging to walk on a hot summer's day, even short distances, and incentivizes further car dependency. So I think, and others think, that the more we can get more trees into the ground and provide shaded footpaths for people to walk on, the more we'll get people walking, and the more people will be cycling, and that will end up leading to more physical activity and better health in general, and hopefully less diabetes in the long term. Next slide, please, Shao. Now, with all that in mind, we can see that there are investments being made in trying to alleviate inequities and improve access to green space and tree canopy in particular. So how do we get people out onto the streets? Do we just assume that a build it or plant it and that they will come approach will work? Well, not necessarily. And so this is where Xiao and I are going to be taking some of our research into the next 5 years, and we'd be really interested in anybody on the call who would be interested in working with us on it. We've got a project called Less Netflix, More Nature. And the idea is that some of us are just really interested. You don't have to incentivize us at all. Just give us an extra 30 minutes in the day and we'll be outside like a shot because we're just outdoorsy people. But not everyone is outdoorsy. Some people just prefer to stay inside. How do we persuade? How do we motivate more people to get outside and to bask in the wonder of nature and to get all the health benefits that all the studies that Xiao and I and others around the world are repeatedly showing now? Well, nature prescriptions might be part of the answer. These have already been run for many years in the US. They've started to be run in Canada. Trials are now being funded across the UK, and there is talk about this happening in Australia. Xiao and I want to make sure that nature prescriptions, however they get rolled out in Australia, are evidence-based, so we know what works, what is acceptable, what's affordable, what's accessible, what's effective and cost-effective in our neck of the woods. So we need local data, and we need to work with people who know the areas in different parts of Australia very, very well, who work with local communities. So this is an invitation to anybody on the call who's interested. Get in touch. We want to work with you over the next 5 years to make this happen. Next slide, please, Xiao. And this is the final one. If you are interested in any of the nerdy stuff that we've been talking about in this presentation, or just interested in learning a little bit more about our activities in the lab, the students who we are raising as the next generation of urban greening and health researchers, some of the events that we've been organizing, the stuff that we've done in the past, more of our talks, newsletters and all the rest of it. We try and put everything that we can onto our website. Here it's powerlab.site, very easy to find online. And meanwhile, if you're just interested in having a conversation and learning more, feel free to get in contact with us with our social media or email. We're very happy to discuss and actively encourage you to get into contact. Thank you very much to Bron and everyone for inviting us today. It's been fun, and we look forward to answering your questions.
Perfect. Thanks so much, Tom and Xiao. We've got a couple of questions. Just for anyone listening, if you've got some more questions, now's the time to put them in. So firstly, we've got, how do you define high quality green space as opposed to low quality green spaces in your studies?
That is a very good question. As earlier I mentioned, we are not sure that either, because people have different perceptions. And I think this is one of the value about the earlier study we have done, because that was not an objective measurement, like through auditing, but it's actually what does the children and their parents think about the quality around it, because only what you think important or high quality that matters. But with this research project, we have had a workshop with quite a lot of policymakers and also landscapers and planning and councils, trying to learn a little bit about the park quality from their eyes. So we're still working on that, but there are some qualities I think everyone probably would agree, such as safety and walkability. But there are other features some people also think probably is very important. For example, whether there's a toilet in a park or there's a water features. But there are some in a little bit debate. So this is where we're going to test out. And also, I guess this, the quality have to be for the people who living in the neighborhood, where you might have a lot of children in your neighborhood. It would be great to have playground. But where you have a large population, probably aging population, we really need to make sure the park quality is good for them so that they don't falling on them. That is really bad for potential injury.
Excellent. And I guess like a follow-up question to this one would be that are there any plans for any studies that focus on the effect of remnant bushland in urban areas as opposed to a park or a playground as a green space?
Yeah, that's a really interesting question. It speaks to some of the work that Xiao and I are currently trying to get started, where the different functions and types of green space that are out there, including what you've said, but also sports fields and cemeteries and linear parks along the side of rivers and all the rest of it. All of these could play different roles at different points in our lives. One clear example is for a big sporting event, a sports oval nearby within a short walk from home could be very important, not only from the point of view of taking part, but also going and getting involved in the camaraderie and the cheering on and the festivities around it. But meanwhile, like a cemetery, a very different type of experience, one for remembrance of memories of past lives. All of these different types may play very special roles in our lives, and there's a lot more research to be done. So whoever asked the question, please get in touch. We would like to work with you and discuss more.
Perfect. And I guess another follow-up question about sort of the quality of green spaces, and it might be a bit, might not be something you've researched based on what you've sort of mentioned today, but have you at all looked into the quality of vegetation in terms of, particularly in bushland areas of, is it native or is it introduced species, and how that impacts on people's health?
That's such an interesting question. And
it's a very land care question. So
oh no, I appreciate that. No, that's great. The answer is we would like to. The data that we have doesn't permit us to differentiate between different species types.
Yep.
In terms of trees. The great thing is that we can actually differentiate between trees and other types of green space, and that is in so many ways an international first. So if there is data available which can help us to distinguish between species type, I mean, that would be a really great way to keep on being innovative, but we don't have that data at this moment in time. So maybe there are others on the call who have the keys to unlocking that future innovation.
Yeah, excellent. Hopefully if we've got any council people, if they have data at their council, it might be something they can share with you guys.
Yeah, that would be fantastic. Thank you.
Excellent. So did the study include a comparison between schools with asphalt and concrete playgrounds and schools with more green space to measure the impact on children's wellbeing?
That's a really good suggestion. We haven't able to look at that, but I think that potentially will have could potentially make some differences, but we haven't able to. If again, this is something we potentially could work, because not all the schools are really big, and it's really difficult to tell whether it's a concrete or grass, and some of the schools doesn't even have a trace within the school. But it would be really interesting to look at that. Yeah.
Yeah, I would like to also add that the time that we spend in different contexts could matter a great deal here. And at this moment, the quality of the data that's available out there isn't too great. So what we're able to do is say, here's where children are growing up, but not necessarily how much time they're necessarily spending there relative to time spent in school. And that's another frontier that we need to be working on.
Yeah, excellent. Very good point in terms of the timings, how long they spend there and in other places. So I guess similar question, have you looked into how your research could extend into incorporating the peri-urban agriculture spaces into the green spaces? So I guess, out in Penrith and Hawkesbury, it's obviously a lot more sort of small farms, large farms, that kind of thing. Does that factor into any of the research that you've done with green spaces?
It will do, because one of those things which we mentioned on a previous slide about nature prescriptions, these peri-urban areas where there's perhaps a lot of farmland, but also other types of green spaces vegetation nearby may offer very interesting and sometimes even maybe unique experiences out in nature where those prescriptions might occur. And it provides opportunities for thinking about if a person goes to see their GP and they have substantial health issues which may warrant some form of medication being prescribed, but also getting outdoors and being physically active might be good. Taking a load off one's back and just chilling out in some natural environment may be part of it too. Well, where does the GP, where does the local physician refer their patient to? And so maybe there are opportunities here for people working out in peri-urban environments to be the receivers of those prescriptions and provide those natural experiences for people not only who are living nearby, but also in more densely populated areas in the inner city too.
Excellent. So then, I guess another similar question in terms of making that, I guess, those green spaces available to people. So have you found, you spoke to us about Sydney, City of Sydney Council, how they're planting a certain amount of trees per year, and they're making a quite an obvious effort to increase their green space. Have any of the other councils that you've possibly discussed with in Sydney been as responsive to making it available to people? For example, some green spaces aren't as easily accessible, say by public transport or by walking. You know, you'd have to have a car to be able to get there, which, you know, in certain areas might be, you know, they might have a different sort of socioeconomic status that prohibits that.
Yeah, very good question. And I think from my experience with council, I think most of councils are really active, trying to get more tree canopies, and, you know, not any kind of tree like my height, probably not going to provide that much shade. They're really active working on that. Like earlier, Thomas mentioned that our research has been used, and also we have been consulted when Wollongong Council also making their greening strategies. And we are also actively working with Blacktown Council. They're really working hard, trying to get more trees and in their council area, and to find various ways. And it's like Kira, what you mentioned, say, if whether we could eventually walk from our home to some public transport, bus stop, or even shopping mall, and which is a tree shaded path, and they're really working on it. And I'm really glad to see that. But again, I also see some people mention that too. A mature tree take years to grow, and then that we may not see it instantly about the greening we are looking for, but we have to work on it. And this is why I think it's never too late to grow a tree and plant a tree, and because that not only benefits us, but it's going to benefit our next generations.
Excellent. Thank you. So I'm just reading a couple of the other questions, sorry. So with all the projects occurring across Greater Sydney as part of the Premier's priority, is there a guide to science-based survey information for councils to be able to survey pre and post projects? To sort of, I guess, provide that local data to show the importance of the project. Is that something that you guys have come across, I guess, in your research, that there's a template, I guess, to have a pre and post sort of look at it?
I'm not aware of any template that would guide the scientific, or we could say epidemiological, evaluation of urban greening. However, my experience is that these sorts of things are best done in partnership. And if there are people on the call who would like to do this, then we are all ears and would very much be interested in co-designing those types of before and after studies, so we can get you a proper, robust, on-the-ground evaluation for the health and maybe social returns on investment of the urban greening in your neck of the woods.
Excellent. Another interesting question is about, I guess, the passive and the active interaction with green spaces. So has there been any research that you've come across or done yourselves that, study the difference, I guess, between actively being in green space in terms of, say, bush care groups or land care groups, so actively going out to that green space to enhance it, or I guess it sort of is a similar in terms of maybe sporting teams that go out regularly to those green spaces, versus people, I guess, just passively enjoying those green spaces, so on their way to work or something similar.
I can tell findings from 2 studies done a few years ago now. There was one by Robert Ulrich over in the US, and this is a rather famous one, so many on the call may have already heard this. And what happened was, after this was set in a hospital, and these were people who all had the same operation and were recovering on a ward, and there was 2 sides of the ward. One set of beds were facing windows which looked out onto a Dulles Dishwater building on the opposite side of the way, no view really whatsoever. And the other side had a view of a lush parkland. And Ulrich was able to find, looking at how these patients did in post-operative recovery, that the recovery times were substantially quicker among those who only had a view of the parkland. So they weren't in it. I'm not sure they could necessarily smell it. I'm not sure they could even hear it, but they could see it. And this seemed to be the only difference, according to Ulrich, that was leading to these improved recovery times. So that kind of indicates a sense of the passive benefit. There was another study, which was done a few years ago, and I think it was in Sweden, by Koenigs. And what they were able to find was that a walk through a parkland was good for the people's mental health. If people were stressed out before they started the walk, then they got a better return on investment for that walk if they were walking solo. Okay, so they were walking on their own through the park, and that was able to flush away the stress that they had experienced. For those who started the walk not stressed, they felt pretty good, they actually got a much greater return on their investment if they're walking as part of a group. So the benefits from green space very much depend upon whether we're feeling stressed at the time, whether we're experiencing some form of health issue, but also who we are with and how we're feeling at the time too. So it's all very contingent in many ways. But what it always seems to suggest is whether you're on your own, whether you're with someone, whether you're recovering from an operation, whether you're just out to have a good time, getting out in green space seems to be good.
Awesome. Yes, so many variables for all of those, but it's good to hear. And we might just go 1 or 2 more questions. So there's one that, nature includes birds and animals and that kind of thing. Are there any studies that sort of, I guess, encompass whether these people, when they're on their walks, I guess, sort of recited that, oh, and I saw a really cool bird, or, I saw a really tiny flower on the ground, but it was just so pretty, and, that kind of thing. Does that really impact that of people's, I guess, benefit from being in that green space as opposed to just trees?
Well, I think without the trees, I have to say those birds probably wouldn't be there. And that's why I think, it's a multi-benefits that if we have high quality green space, I'm not saying other things not important. Grass is very soft and nice, which and also little brushes provide the varieties. So that's why I think, it's a complete package, I would say, that if you actually interact with the nature. And just going back, earlier that question also Thomas answered, I think it's just the research shows, but also just personal experience, whether it's passive or you're active engaging with the green space, is always bring you some health benefits or the joy. But I also thinking, I can see one of the questions that I think Lindy asked is that how we can actually bring people to the nature, because there are people, they not actively or neither passively engaged. They just don't like to, or not really active connect with the nature at all. But all these benefits, our study shows, and all other researchers have shown, pretty much solid. And it thinks that if we could bring people to nature, it doesn't matter if it's active or passive, they can get the benefits. And I would really like to work with people that if you have the similar mind that now we know green space is good. And so how we can work together to bring the nature to people or bring people to nature.
Perfect. Just two more questions. So have you, in your research, have you had a lot of hospitals and I guess health sites come to you to ask about design for their hospital to include those green spaces? I know with our Creating Canopies program, we've done a few plantings at hospitals. So we've done Fairfield, Campbelltown, Westmead. We're soon to do Mount Druitt Hospital. So, you know, I personally know that hospitals are sort of trying to increase their green spaces, but is there anything that you'd suggest around the design? Like, should there be green spaces on all sides or just on the side that gets the most sun or that sort of thing?
Oh, that's a great question. In the absence of robust evidence at this moment, I would go based upon what I've experienced and also what other studies have shown. And that is all sides, as much greenery as we can, but not only on the ground, but green roofs too. And where that's possible, green walls inside as well. So whatever the person's condition who's in the hospital, and not just the people who are in the hospital because of some health misadventure, but the people who work in hospitals too, the doctors and the nurses and the administrators and the people in the coffee shop and all the rest of it. So everyone benefits from what would be quite a restorative and maybe even regenerative experience. I think that this is a really fascinating area of research, which is being referred to as sustainable healthcare. It's a big part of the agenda that Xiao and I have going forwards. And back in the UK, there's been a big drive towards tree planting across hospital grounds all over the country because the NHS is one of the largest landowners. I think we should be doing a little bit more about that in our patch of the world too. And it sounds like people are. So let's talk more about that. And maybe there's opportunities for some health evaluation there as well.
Yeah, I totally agree with Thomas. And not only we should limit to think about the green walls or have some plants in the hospital looking good, but really we should think about the space for some meaningful green space that for the patients, but also people work there to use. Probably, you know, we all probably have been to hospital. Most of places of rooms, there's not even have a window. So it would be fantastic for the patients and also for the healthcare workers. When they are in break, they actually get some nature, fresh air and the sunshine in the green space, and it's good for their social and mental health as well. So if you're working in a hospital and think about to design your hospital with more greening and also want to test it out, which works, I would be very grateful to speak to you and also work with you on that. Yeah, thank you.
Perfect. Okay, so we'll stop with the questions that people are submitting for there. Otherwise, I think we could probably go for another hour or so. But I guess the next main question from me is just, how is it best for people to reach you? So there's a lot of people commenting saying they're either from council or they'd like to discuss certain things with you, or they've got a few suggestions of people and places that you could talk to in regards to your research. What's the best way for them to get into contact? Is it through your website?
Absolutely, through the website. There's contact details on that. Both Xiao and I are also on Twitter and LinkedIn. I think I can't see the bottom of the screen, but our Twitter handles should be at the bottom. And I think my LinkedIn is the same. I can't remember these things. But certainly, if you type in my name onto Google, there aren't many Thomas Astelberts in the world, so it should be I should be one of those people who gets who's listed, and Xiao is also on LinkedIn, I know too.
Yeah, it's very easy to find us. I guess being academia, we are quite visible. Just the type of name and maybe with our university, it should be really easy to find our email address, and we'll be love to speak to you and with a shared interest. And thanks for all the great questions. And I think this is a really great discussion to learn from each other and keep thinking and what the research area that we could develop and provide evidence to support your work and also the potential policies you're going to make.
Yeah, and I would just like to say that our work is a passion project because we're very interested in the outdoors, and the climate crisis that we are living through today is the #1 public health challenge of the 21st century, and urban greening and the conservation of green spaces across the country and other parts of the world too is a vital part of how we are trying to address that. And I think every single person on this call is working extremely hard to make our cities and other residences greener. And our research is also indicating that what you're doing is making our communities healthier. So thank you for your efforts. Thank you.
Perfect. Yeah, we've definitely got a lot of dedicated people, and as you said, a lot of passionate people. Excellent. So a couple of people have also mentioned that, can they share this and everything like that. So we've actually got this live on Facebook, so you can go to our page and share it from there. Bron as well might also upload this separately, maybe tomorrow or early next week as well. So feel free to share that to all your sort of pages, or potentially your MPs, if I might be a little bit cheeky to say so. And we can try and spread the word in terms of this research and about making our spaces greener. So I'll pass over to Bron. Thank you again, Tom and Xiao, for everything. And yeah, Bron, I'll just wrap up with how creating canopies is, I guess, helping with the impact on our green spaces.
Thank you, Kira.
Thanks.
Thank you.
Great. Yeah. Hi, everybody. Thank you so much, Xiao and Thomas, for your really inspiring presentation. Yeah, so just, you may be feeling like planting some trees now, and Greater Sydney Landcare has been implementing the Creating Canopies project in partnership with Landcare New South Wales. So we're planting 100,000 trees throughout Greater Sydney, including at a few hospitals, as was mentioned during the presentation, so to green those spaces. So it's not just beneficial for mental health and well-being, it's creating habitat in quite a fragmented environment in Sydney, so creating migration corridors for wildlife as well, also capturing a bit of carbon and welcoming people to nature. So if you feel like, after lockdown finishes especially, getting outside and planting some trees in the ground, you can get in contact with us as well. So you can check our website, it's greatersydneylandcare.org, or check our Facebook page, or you can email us at trees@greatersydneylandcare.org as well. Next week, we're having another webinar, and that's with the Hawkesbury Nepean Landcare Network. They're going to be talking about their work creating koala corridors, so creating koala habitat through the Hawkesbury Nepean region. That'll be a really interesting one as well. So you can join us for that. Thank you again to Xiao and Thomas, and all of you for joining us. And I hope you're looking after yourselves, and we'll see you again soon. Thank you.
Thank you, Bron.